Hello, welcome to the Sugar Mama Radio Show with your host, Mathia Ford. Every week, we talk about pregnancy, motherhood, and gestational diabetes topics, and answer your questions about all of the above. Email us at radio@sugarmamaradio.com with your questions, and go to sugarmamaradio.com to sign up and get a free gift, as well as notified when we have a new show. Now, what you've been waiting for, here's Mathia with the show.
Hi, this is Mathia Ford with Sugar Mama Radio, and I'm back again to talk to you some more about gestational diabetes and all things related to pregnancy and motherhood. I want to remind you that you can go to our website at gestationaldiabetesinfo.com and /call, and we have a every other week call where you can go in and ask questions. So you can find out more about the call at that website. Go to gestationaldiabetesinfo.com, sign up for the email list, and I have some courses on Udemy, Udemy, that you can go to, and I'll send out discount coupons for those. So that's all the pre-stuff. This week we're going to talk about how is gestational diabetes diagnosed. That's very important. I know you've been listening to me talk about what is it and what are the risk factors and stuff, but what happens? So how is it diagnosed? Each month of your pregnancy, you're going to go and have a prenatal exam by your healthcare provider, whether it's a midwife or a doula or a doctor. And during your visit to the office or the clinic, you'll provide a urine sample to the nurse. Among other things, the doctor or midwife wants to determine if there is glucose or sugar in your urine. So every time they do a little dipstick test in there to see if there's sugar in the urine. If your body is spilling glucose or sugar into your urine, it's a warning sign that you may have gestational diabetes. So they're looking for it in there because that would mean you have too much in your blood. This is caused by having too much in your blood, so your kidneys, basically at about 180 milligrams per deciliter, it starts spilling into your urine, and your kidneys take it out of your bloodstream to keep the number down, and it ends up in your urine. Problem with that is if you have too much sugar, then you can get urinary tract infections, so you have to watch out for what your body is removing. The next step is if you have tested positive, or at about week 24 to 26, some doctors just send you for a lab test, really as a precaution. But the doctor may take to test your blood sugar in the office with a glucose monitor, so they may use a finger stick test. It's a little small transportable device that if you have gestational diabetes, you will get intimately aware of. It has a reader, it has lancets, it has testing strips, and all they do is take your finger and prick it, and then the drop of blood is put onto the strip and placed into the reader. Depending on the reading the monitor provides, your doctor may or may not order a blood test at the lab. Some doctors may not test your blood sugar in the office and may send you directly for a lab test. So with the blood sugar monitor, your level matters as far as when you just ate, and when you, exercised, if you walked up the stairs, whatever. So your level on the blood sugar monitor, and it can be within about 10%. So it could be reading just a little bit off. So sometimes they'll send you to the lab as a precaution. To be on the cautious side, most doctors, if it's a little high or if you have urine with glucose in it, they'll send you for a glucose tolerance test at the lab, regardless of the blood sugar level in the office. So a GTT. This is a fasting test, and you'll not be able to eat for 10 hours before having your blood tested. For this reason, the tests are usually performed first thing in the morning, and you don't eat anything after midnight the night before. So you go in and you get it tested first thing in the morning. Let's talk about what happens during the test. When you arrive, you're going to have your blood drawn initially, and then they're going to give you a drink that's high in sugar. It's called glucola, and it's a lot of sugar all at once. They usually have some different flavors like orange or lemon lime or sometimes cola flavored, but it's going to taste very sweet. After drinking this, you'll be asked to wait 1 hour and have your blood tested again. The results of that test will tell you how your body's processing the sugar in your body. It's known as the GTT for short. It gives you a set amount of sugar in a set amount of time. So they usually give you about 10 minutes to drink the drink and then test it about an hour later. And then it's testing how your body responds with insulin and controls your blood sugar to show the doctor if you have gestational diabetes. Sometimes these GTTs can take 3 hours, so they may take an hour, 2 hours, and 3 hours just to see kind of how your body's reacting. And usually what happens is if you are high for one or for two of those, then it's diagnostic for gestational diabetes. But if you're only high for one, then they may say you're borderline. If you're borderline, you still need to try to follow a healthy meal plan and watch your amount of carbohydrates and try to eat and exercise. If the test comes back positive, then, like I said before, you'll be referred to a specialist for further care and treatment, either a registered dietitian or a nurse, somebody who's possibly a diabetes educator. So I just wanted to talk today about the test and what happens. I would recommend for the test, since you're going to be there for 3 hours probably, you want to bring something to do. You want to bring some reading material, some crossword puzzles. You know, they have old magazines usually in the lab, so I would recommend you do that. It's just to make it time pass a little faster, not so miserable. And then just wait, and the lab should be back in a week or so, and just let your doctor know, or your doctor should let you know once they get them back. So that is how they do the diagnostic test to find out if you have gestational diabetes. And again, you probably are going to be there for 3 hours and get tested at every hour. And then you'll be able to leave and go eat something normal if you're not too nauseous. Okay, that's it for this week or this episode. And I look forward to talking to you again in the very near future about some different blood sugar guidelines for gestational diabetes if you happen to be diagnosed. Thanks.